All right, so this chapter is covering three things that work together: nursing knowledge, nursing theory, and evidence based practice. It's every time you do something, every time someone asks you, why did you do that, right? You should have a real answer, not just because my preceptor told me to, but an actual reason backed by science. And this is the chapter that teaches you how to build that answer. So, what exactly is knowledge? Well, knowledge is just knowing things, but knowing them because you learned or investigated, not because you guessed. And what's really special about nursing knowledge is that it's not just from one field. To take care of a patient, you need to understand biology, the body, psychology, the mind, sociology, how families and cultures work together, ethics, how to make ethical decisions. You even need to understand how money and technology affect healthcare. That's why your prerequisites, can feel like you're studying 10 different things, because nursing actually does pull from all of them. A doctor mostly needs to know disease. A nurse needs to know the disease and the person and their whole life situation. So nursing has two parts, and you need to be doing both or you're not really nursing. The first part is the body of knowledge. Now, the body of knowledge is the reason behind what you're doing. So, for instance, you may raise the head of the bed for someone who can't breathe well. And the reason behind that is that gravity pulls down the abdominal organs, which lets the diaphragm move more freely and lets the lungs expand more. And then the second part is application, actually walking into that room and raising the bed. And you need both, right? A nurse who does who does tasks without knowing why they're doing them, is basically a robot, and a dangerous robot at that, because the moment something unexpected happens, they don't know how to adapt. And a nurse who knows everything but freezes at the bedside can't help anyone either. So real nursing is about both the knowing and the doing. Now, this list comes from the American Nurses Association, and it shows you the scope of nursing. Basically, it's everything that affects a patient's health. All of it is pretty much fair game for nursing, within scope, of course. You don't need to memorize it all. Just notice the pattern, right? It's not just physical stuff. We're also dealing with emotions and spiritual comfort and cultural issues, family relationships, decision making, even social policies. For instance, if a patient says, let's say you have a diabetic patient whose blood sugar keeps spiking, and a doctor adjusts the insulin. A nurse asks, can you afford the insulin? Do you understand how to use it? Does your family pressure you to eat foods that spike their sugar? Are they depressed? Are they skipping doses on purpose? Do they have a fridge to store the insulin? All of that is nursing, right? We're treating the whole situation, not just the disease. All right, question number 1. So, a nurse educator is describing the body of knowledge that supports professional nursing practice. Which description is most accurate? I'm going to step back. Please go ahead and answer. And the correct answer is D, a broad knowledge base drawn from nursing, science, and many other disciplines. Because professional nursing knowledge includes nursing science, philosophy, ethics, biology, psychology, sociology, a bunch of different sciences. And it's really this breadth that allows nurses to address the whole person within their environment. Now, there are 3 ways that nurses know things. The first of those is traditional knowledge. Basically, traditional knowledge is, well, this is how we've always done it. A really good example of this is bed linens. A lot of hospitals change patient sheets every single day. And why? Well, nobody really knows why. There's no study showing that this improves outcomes. It's just what we do because it's what we've always done. So millions of beds every single day by tradition are getting changed. Now, that's not a bad thing. That sounds nice. I would want you to change sheets. It just feels better. Um, my point is that tradition isn't automatically bad. Sometimes they exist because they actually work, but we just never tested them. But the danger is that without that testing, you cannot tell the difference between a good tradition and a useless tradition. So when you start clinicals and you see something being done a certain way, get in the habit of asking yourself, is this based on evidence, or are we just doing this because we always have? And that single question will make you a better nurse than, half of the people you're working with. The second source of nursing knowledge is authoritative knowledge. You believe something because someone you trust as an expert told you so. So when a nurse with 20 years of experience teaches you a slick way to start an IV and you accept it because she's been doing this since before you were born, that's authoritative knowledge. The problem isn't that experts are bad. They're often right, and you should absolutely learn from them. The problem is that experts can be outdated. Maybe she learned that technique in 1998, and the research since then has changed. Maybe she picked up a habit that's actually wrong, but no one ever called her out for it. So here's the rule. You respect your mentors, but you don't shut down your brain, right? So notice on the slide, it says, I notice your technique is different from what we learned. Can we talk about it? So you're not being rude, you're being professional. And honestly, as a student, you have a free pass to ask questions that staff nurses sometimes might feel embarrassed to ask. Use it while you have it. The third source is science, scientific knowledge that comes from actually testing, something with measurements and objective criteria instead of opinions. So here's why science is special, right? It works the same everywhere, right? If a study proves that a certain hand washing technique cuts infection rates, and that finding is going to work in California, in Egypt, in rural Alaska. So tradition, whereas tradition and authority are tied to specific places and people. What we've always done in one hospital is different from what we've always done in another hospital. And one expert might disagree with another expert. Science cuts through that, right? This scientific knowledge is the foundation for evidence-based practice, which we're going to spend a lot of time on. So here's the bottom line. If tradition says one thing and an expert says another, and research says a third thing, research wins. That is just the modern standard. All right, so here's the next question. I'm going to be trying out a new quiz feature. Please let me know how you feel about it, if we should continue using it or if we should stop. So here's the question. A nursing student observes a staff nurse changing a patient's bed linens, even though they are not soiled. When the student asks why, the nurse responds, "We change them every day. It's just what we do here." Which type of knowledge is the staff nurse using? And the correct answer is traditional knowledge, right? Traditional knowledge is the part of nursing practice that is passed down from generation to generation, expressed as, well, it's how we've always done it. There's no research supporting the practice, yet it persists as a tradition. If it was scientific knowledge, she would have said something like, well, it came from research or from this scientific method. One easy one that you may have confused it with is authoritative knowledge. Authoritative knowledge would be if she had said, well, I've had this many years of practice and I can tell you that this is the best way to do it. She's appealing to herself or to somebody else as the expert. In this case, though, she's saying this is how we've always done it, meaning traditional. It's tradition. Next question. A new graduate nurse adopts a wound care technique demonstrated by a charge nurse with 15 years of experience, even though it differs from what was taught in school. Which type of knowledge is the new graduate relying on? And the answer is coming in 3, 2, 1. The correct answer is authoritative knowledge based on perceived expertise. So, authoritative knowledge, in this case, is being accepted as truth because it comes from a person that this new grad sees as an expert, right? She's accepting the senior, or he's accepting the senior nurse's technique based on their years of experience. If it was traditional knowledge, it would be a unit-wide custom, right? It'd be knowledge that everybody is doing on that unit because it's how they've always done it. Whereas scientific knowledge would require research validation. And all right, let's move on. All right, so quick comparison. Let's look at them side by side. Traditional knowledge, easy to follow because everybody does it, but it might be wrong because nobody has tested it. Authoritative knowledge, it's practical because you have a mentor that's showing you how to do it, but it really does depend on whether or not the mentor is correct. And then there's scientific knowledge, which is objective and works across settings, but it's slow because real research takes time. Now, all three exist in nursing, and you will use all three. But for your exam, science is the foundation of evidence-based practice. So if a question asks you which source is the gold standard, pick scientific. All right, talking about nursing, you can't really have a discussion about the foundations of nursing without talking about Florence Nightingale. So she lived in the 1800s and basically invented the concept of nursing as a profession. Now, there are three things you need to know. Number one, she proved that nursing works with data. During the Crimean Wars, soldiers were dying, not from war wounds, but from infections and from filth. Nightingale cleaned up the wards, she improved nutrition, and she organized care. And she actually wrote down the death rates before and after, and the numbers dropped dramatically. She used statistics to prove that what nurses do actually matters, and that was revolutionary. The second thing is that she said that, hey, nursing is its own thing. It's not just helping doctors. Before her, being a nurse was basically being a doctor's assistant. And she said, no, nursing has its own focus and its own base of knowledge. And then the third thing is she split nursing into two types. Number one, keeping people healthy, which is health nursing, and caring for sick people, illness nursing. Both matter, and today we still do both, right? Think of public health nurses who are actively preventing diseases, while hospital nurses are treating those diseases. So really, the reason that you're studying nursing as its own science, rather than being trained to be the doctor's helper, is because of the work that people like Nightingale did almost 200 years ago now. Now we're going to go through a quick history of how nursing became what it is because the book covers it. So starting from the early 1900s, there was really no real nursing curriculum. You learned by listening to doctors lecture and by working long hours in the hospital. You took orders, you did not think for yourself. The nurses in the hospital were controlled by the physicians and the hospitals in general. By the mid-1900s, World War I and World War II came around and changed things. So during this time, women had to work outside of the home in huge numbers, and as a result became more independent, started going to college, and nursing followed, right? School became real education programs. Research started. Nurses began to be recognized as a science instead of just as a service. And then moving on to the 21st century, today we have PhD programs in nursing, doctoral research, and nursing has its own seat when at major healthcare policy tables. So the discipline went from being doctors' helpers to being a recognized scientific discipline. The main point is that nursing being a profession was not an accident. People fought for it over the past century. All right, practice question. A nursing instructor is teaching students about Florence Nightingale's contribution to the profession. Which of Nightingale's actions has had the most significant impact on establishing nursing as its own discipline? Go ahead and answer. And the correct answer is B. So defining nursing practice as separate and distinct from medicine. Yeah, exactly. Remember, she helped shape nursing in 3 key ways: demonstrating efficient and knowledgeable nursing care, defining nursing as a separate and distinct practice from medicine, and differentiating between health nursing and illness nursing. Moving on. Now, really quickly, let's talk about the future of nursing. So around 2011, the Institute of Medicine, I think they're now called the National Academy of Sciences, Engineering, Medicine. They put out a report called The Future of Nursing, and it had 4 big recommendations. The first is that nurses should be allowed to do everything they are trained to do. Now, this is especially big for nurse practitioners because in some states there are laws that say NPs can't prescribe certain things even though they are trained for it. And the report says, hey, get rid of those barriers and let educated nurses practice fully. The second is that nursing education needs to keep evolving with research. Third, nurses should be leaders in healthcare, not just task doers, right? Nurses should be on the committees and the boardrooms helping to shape policy because nurses are the ones that are at the bedside actually seeing what works in the real world. And then fourth, we need better data on the nursing workforce so that way we can know where the shortages are. Now, you don't need to memorize this report, but do know that it exists and know that it keeps that reports like this and initiatives like these keep nursing at the forefront of healthcare and keep pushing nursing to be a more powerful profession. All right, we're moving right on along to the next section, which is on nursing theory. Now, the word theory makes a lot of students go green in the face because it sounds like a philosophy class. But stay with me because theory in nursing is actually really practical. It's just a framework that organizes how we think about nursing. Now, a theory is just a group of ideas, concepts that fit together to describe some pattern in reality. That's it. Don't overthink it. You can kind of think of like an analogy of a house, right? The concepts are like the bricks, the boards, the nails. A pile of bricks don't make a house. You need a blueprint that tells you here's how they fit together. Here's how the bricks and the nails and the boards go together. A theory is that blueprint. It takes individual ideas and it arranges them so that way they make sense as a whole. Now, here is something important. Theories are not permanent. If new evidence comes in that shows that a theory is wrong, we change the theory. That's how science progresses. We don't cling to old ideas, but we update them as we learn more. To think your way to a theory, there are 2 ways you do that. And you do need both. The first is deductive reasoning. So you go from a big general idea down to a specific case. For example, I know that all human beings need oxygen. That's general, right? My patient is human and isn't breathing. That is a specific case. Therefore, my patient needs oxygen now. I started with the general rule and then I applied it. to the individual. The other is inductive reasoning, which goes in the opposite direction. We go from a specific observation up to a more general conclusion. So, for example, I could say, I noticed that patient A, felt better after I repositioned him. Patient B also felt better. So I did the same with patient C. And then I start to think, hey, maybe repositioning generally helps with comfort. So I built a general rule from individual observations. Both ways are absolutely valid. Deductive starts with the rule, inductive builds the rule. So if you're in a test and you see that the phrasing goes from general to specific, that's deductive. If it goes from specific to general, that's inductive. All right, practice question. A nursing instructor asks students to define a theory in their own words. Which student response is most accurate? And the answer in 3, 2, 1. The correct answer is B. A theory is a group of concepts that describe a pattern of reality, right? What theories do is that they organize ideas in a way that helps us to understand how things work. And then we can test them and change them and use them to guide research and to guide practice. I want to say again that a theory is not a proven fact. Theories can and should be revised as new evidence comes out, right? All right, let's take a look at a few theories. Let's start with general systems theory. So this theory was developed in the 1920s, and the basic idea is that things in the world work as systems, as a collection of parts that interact with each other. Now, there are 3 principles. The first is that the whole is greater than the sum of the parts. So a heart, a lung, a brain, if you just had them sitting on a table, well, those aren't a person. But when you put them together with everything else and connect them, now you have a living being. Now you have a living human being, which is way more than just, a pile of organs. The second is that a change in one part affects the whole system. And this is huge for nursing, right? If your patient's kidneys starts failing, it doesn't just affect their urine output. It affects fluid balance, blood pressure, electrolytes, the heart, the brain, everything. The body is one connected system. A change in one part affects the whole system. Then third, open systems exchange with the environment. Humans are open systems, right? We breathe in air, we eat food, we give off energy and waste. We are constantly trading stuff with the environment. So open systems exchange with the environment. Now for nursing, what this means is, never look at one symptom in isolation. A classic example of this would be, let's say you have an elderly patient who suddenly becomes confused. A new nurse might think mental problem. An experienced nurse knows that in the elderly, a UTI often shows up as confusion because the body's systems are connected. That is systems thinking. Next up, we have adaptation theory. Now, adaptation theory says all living things are constantly adjusting to their environment. Right now, you are adapting to your environment. Your eyes are adjusting to the lights, your body's adjusting to the temperature of the room. You're constantly adjusting. Now, there are 3 levels of adaptation, and the patient can be doing all 3 at once. First, we have internal, what's happening inside of the person, both physically and mentally. So, for instance, when you're sick, your immune system kicks in, right? Physical. When you get bad news, you feel grief. Mental, all of those are internal adaptations. The next one that we have, the next level of adaptation, is social. How a person adjusts through relationships. For instance, a patient in the hospital has to adapt to nurses and doctors, and maybe roommates and family members visiting. It's a new social environment, so they have to make new adjustments there. Next, we have physical / biochemical. That is your body's chemical reaction to the environment. So let's say you're sweating in the heat, or maybe you're shivering when it's cold, or your liver processing a medication. We're talking pure biology on this level. So for nursing, maybe think of a patient who gets a serious diagnosis like cancer, right? They're not just dealing with one thing. Their body is changing physically, right? They're scared, they're grieving. On a psychological level, their relationships are shifting on a social level. And your job is to support all three levels of adaptation. If you focus only on treating the body and you ignore the rest, well, you're missing 2/3 of the patient, according to this theory. Next, we have developmental theory. Now, developmental theory says humans grow in a predictable pattern from birth to death. Now, there are two big names you have to know when we're talking about developmental theory. The first is Erik Erikson. He said that life has 8 psychosocial stages, and each stage has a specific challenge that you have to walk through. For example, an infant faces trust versus mistrust. How do they learn that the world is safe and that people will care about them? That's their challenge at that phase. Or teenagers, he says, are facing identity versus role confusion. They're asking, who am I? Whereas an older adult is facing integrity versus despair. Was my life meaningful? Now, you don't need to memorize all 8 today unless you've been specifically told to do so. But you do need to know you do need to know that Erikson means stages and tasks and challenges across the lifespan. Then we have Maslow, Abraham Maslow. He created the famous pyramid called the hierarchy of needs. The 5 levels from top to bottom are physiological safety, love and belonging, esteem, and self-actualization. And the key rule here is that the lower needs generally come first. A patient who can't breathe doesn't care about their self-esteem. A patient who's in severe pain isn't ready to talk about their life goals. They care about the bottom of the pyramid first. So we want to take care of the bottom of the pyramid first. So Maslow is one of the most useful tools you'll ever learn for prioritization. When you have 10 things to do and can only do one, you want to do the one that addresses the most basic needs. You can expect Maslow questions basically on every nursing exam you take, including the NCLEX. All right, question time. A patient newly diagnosed with cancer is experiencing physical symptoms, fear, and change in family relationships. Using adaptation theory, which level of adaptation does the change in family relationships represent? And the answer in 3, 2, 1. The correct answer is social adaptation. So, remember, adaptation theory, we're talking about the 3 levels of changes: internal, social, physical, or biochemical. And when we are talking about changes in family relationships, well, that reflects social adaptation. Fear is an internal adaptation. The physical symptoms would be biochemical and physiological. But in this case, we specifically asked about the change in the family relationships. So that would be social. Now, what does nursing theory do for you? Well, theory gives you 4 things in practice. Number 1, a rationale for what you do. Number 2, a framework so that way you know how to handle new situations that you've never seen before. Strong problem solving and a foundation for research. So in the big picture of things, theory, practice, research, they're just three sides of the same coin, and they're all constantly feeding each other. Next question. A nurse is using general systems theory to guide care for a patient with newly diagnosed kidney failure. Which statement best reflects a key principle of this theory? Answer in 3, 2, 1. And the answer is B again. A change in one body system can affect the entire person. Remember, general systems theory emphasizes that systems are made of interacting parts, right? A change in one part can affect the whole system. So in kidney failure, a declining kidney, that a declining kidney function affects fluid balance, blood pressure, electrolytes, the heart, the brain, everything. The brain body systems do not function independently, right? Moving on. So now we have these four concepts in all nursing theories. Now, every nursing theory that's ever been written addresses these four concepts, and these four concepts together are called the meta paradigm of nursing. And that's just a fancy word that literally means these four ideas that all nursing theories share: person, environment, health, and nursing. So, person, when we say person, we're talking about the person that's receiving care. And this is the most important one because the point of nursing is to serve people. Then environment, everything around the person that affects their health, their physical surroundings. But this also includes their family and their culture and their society. Next, we have health, right? We're talking about what exactly does it mean to be well. And different theories, depending on what theory you're looking at, define this differently and they address this differently. For some, they're talking about the absence of disease, while others are talking about more of a state of total well-being. Either way, no matter how they define it, every theory addresses it. And then the last is nursing, the thing that nurses actually do, the actions, the role, the purpose. All of that goes under this umbrella of nursing. Now, this concept here is really, really important for the exam. If you're going to have an exam that covers this chapter, at some point someone's going to ask you about this. So remember this. Now, there are two main types of nursing theories. There's descriptive and prescriptive. Descriptive is describing what is happening. And that makes sense, right? Descriptive, describe, descript, describe, right? Literally describing what's happening. They observe and they are identifying the phenomenon and they're breaking it into parts, right? So they're looking to answer, hey, what's going on here? For instance, you might have a descriptive theory that describes what grief looks like in a parent that just lost a child. It's describing, right? Then we have prescriptive. Prescriptive theories go further. They tell you what to do about it. They focus on interventions and what those interventions accomplish. So these are looking to answer the question, what should we do? So one quick way to remember this, remember descriptive, it's in the name, describes. Prescriptive, it's also in the name, it prescribes, right? Like a prescription that tells you what to take, right? Now, you do not have to remember every detail of these, but it is important to recognize these names because they did build modern nursing. So we have Nightingale, and she focused on the environment, right? Clean wards, fresh air, light, good food. Her theory basically said nurses manage the environment so that way patients can heal. let's look next at Henderson. Henderson said, hey, focus on helping the patient become independent, right? A big part of her theory was also that, hey, nurses are independent from medicine. Nursing has its own function separate from medicine. And lastly, let's look at Orlando. Now, Orlando focused on responding to what patients actually express, both verbally and non-verbally. It also played a really, this theory also played a really important role in developing the nursing process. All in all, I'm not going to spend too much time on this, but all in all, each of them added something different, right? And together, they built what we now know as modern nursing, right? So if the test asks you who focused on environment, you're thinking Nightingale. Who focused on independence, you're thinking Henderson. Now, one of the big roles of theory is to guide the nursing process. Now, the nursing process is the 5-step method that you will use every single day of your career. Assess, diagnose, plan, implement, evaluate. Now, theory guides every one of these steps, right? So in assessment, for instance, theory tells you what data to collect. In diagnosis, it helps you organize that data into a problem. In the planning phase, it's suggesting intervention, implementation. It's guiding you on how to carry out that implementation. And then in evaluation, it's telling you, hey, here's what you need to look out for. Now, without theory, you would be wandering around hoping to notice something useful. But with theory, you now have a systematic way to approach every patient. So theory and the nursing process are working together, with theory informing how you behave at each step of the nursing process. So when nurses use theory to guide practice, 3 important things happen. Nurses gain autonomy. Nursing becomes more credible as a profession. And nurses become more accountable for the care that they provide. So first, let's look at autonomy, right? Autonomy means nurses are using nursing knowledge and clinical judgment to make decisions independently. They're not just completing tasks or following orders. So for example, if a nurse notices a subtle change in a patient before the patient becomes unstable and intervenes early, that is autonomous nursing practice in action, right? And nursing theories are what help nurses think critically and make those informed decisions, which supports their ability to practice independently. Secondly, credibility, right? Credibility comes from being able to explain the rationale behind nursing interventions. So when nurses can connect their actions to nursing theory and evidence, their care is seen as more professional and as more trustworthy. We know you're not just winging it, right? For instance, instead of saying, I repositioned the patient because that's what we do, a nurse can explain that, hey, repositioning helps prevent pressure injuries and improves circulation and promotes comfort. And that explanation gives the intervention more professional credibility than, well, I just did it because I thought it would be good. Third is accountability, right? Accountability is about nurses being responsible for the care that they provide and being able to explain and document their clinical decisions. So in modern healthcare, it's not enough to just say a task was completed, right? As a nurse, you have to show why you chose a certain intervention, how it helped the patient, and whether the patient's condition improved afterwards. So for instance, imagine a patient is at risk for falls, right? A nurse might implement fall precautions. Keep the bed low, educate the patient about using the call light, performing frequent rounding, right? And accountability means that the nurse can explain the rationale behind those interventions and document how they helped reduce the patient's risk of injury.